Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the presentation on management of foreign body aspiration in dental settings. Last time we used style 1 of the flow chart to understand this topic. Today we will look at the same topic, but this time through a different lens using style 2 of the flow chart. It is important to see how the same information can be organized and interpreted differently, as this can enhance our overall understanding. We will go through the flow chart step by step, just like we did with style 1. When a large body enters the trachea or bronchus, such as tooth or dental instrument, immediately stop all dental treatment. Position the patient in a sitting posture to facilitate cuffing. Instruct the patient to try to cuff the object out, as cuffing may expel the aspirated material if the airway is partially obstructed. For conscious patient with persistent symptoms, perform Heimlich maneuvers to expel the foreign body. Administer supplemental oxygen to maintain oxygenation. Call medical assistance and continuously monitor the vital signs. Transport the patient to an emergency care facility for further management. If symptoms are absent or resolved, but clinician is unsure if the foreign body was aspirated, administer supplemental oxygen. Continuously monitor the vital signs. Transport the patient to an emergency care facility for chest and abdominal radiographs to rule out asymptomatic aspiration. Bronchoscopy may be necessary to locate and remove the foreign body. You must know how to perform abdominal thrusts on an unconscious patient with a blocked airway. First, recline the dental chair flat. Next, place the heel of your right hand on the patient's abdomen below the xiphoid process. Keep your elbow straight and place your left hand over right hand for extra force. Push your arms quickly into the abdomen, directing the force downwards and upwards. Now let's look at the proper positioning for Heimlich maneuver. Stand behind the patient, place your hands on their abdomen below the rib cage. Quickly pull your hands inward into the abdomen. This action uses any remaining air in the lungs to try and dislodge the obstruction from the airway. This figure shows how to help unconscious patient who has something stuck in their throat using abdominal thrusts. Lay the patient on their back. Place the heel of your right palm on their abdomen just below the xiphoid process. Put your left hand on your right hand to add more force. Push your arms quickly into the patient's abdomen, directing the force downwards and upward. This figure shows the correct way to perform Heimlich maneuver. Stand behind the patient, place your hands on their abdomen just below the rib cage. Quickly pull your hand into their abdomen area. This helps to force air from the lungs to push out the object blocking the airway. If the patient becomes unconscious, immediately have someone call for medical assistance. Place the patient in supine position to perform abdominal thrusts. After each thrust, turn the patient on their side and perform a finger sweep to remove any foreign object. Attempt to ventilate the patient. If the patient is able to ventilate, start basic life support. Administer supplemental oxygen to ensure adequate oxygenation. Transport the patient to an emergency care facility for further evaluation. If ventilation is not possible, repeat abdominal thrusts and finger sweep twice. If the airway remains obstructed, perform laryngoscopy to try to remove the obstruction with McGill forceps. If laryngoscopy is unsuccessful and the patient is hypoxic, an emergency cricothyrotomy may be necessary to establish an airway. Before we conclude this presentation, it is important to note that the slides from 11 to 16, that is after conclusion, show the steps we discussed earlier in a flow chart. Since we have covered all the points, we will skip these slides. Let's summarize and conclude our presentation. Immediate recognition and appropriate management of foreign body aspiration are vital to prevent complications. Follow the established protocols and steps to ensure patient safety and effective treatment. Always seek emergency medical assistance when the situation requires further intervention beyond basic life support. You can note these steps. Good luck.